I mean, the root cause of that vaginal dryness and lack of sex drive is estrogen and progesterone. And we talk a lot about testosterone, but when you deep dive into sex drive for women, sex drive for women is really common. I mean, so let's unpack that, but let's talk about vaginal dryness first. But vaginal dryness, the root cause is low estrogen, but progesterone also plays a role in that. So you'll see vaginal remodeling, increase in collagen, elastin, hyaluronic acid with both of the hormones. So you'll get a better effect if she's on both, right? The right formulations as well. And it has to be enough. I mean, a lot of these low dose vaginal estrogen creams on the market, let's be honest, like, no. And then hyaluronic acid supply, like a lot of them are Band-Aid fixes. There's so much being pushed to women right now. And it's like stuff that's a Band-Aid fix, like hyaluronic acid suppositories. Like anybody's going to put that in and have sex. Like, I don't know. Like, no, like you just treat the root cause. She should, it's like erectile so here's the thing about sex too, is that we have a lot of shame around it. So like for men, we've normalized this. Like erectile dysfunction. Hey, like a man goes to a doctor and he's like, I have low libido and low sex drive. And the doctor's like, you need some testosterone or Viagra. You have a health problem. This is a concern. We need to treat you. Right away, they'll treat him. A woman goes to a doctor and says, I have vaginal dryness and low sex drive. And the doctor will say, you should read a sexy novel and date your husband.
Yeah. Or it's just aging. This is just aging.
Or this is just it becomes a relationship concern. You know, whereas when a man has a problem, it's a health concern. And women are treated like they need to treat their relationship. And this is completely inappropriate, right? Like physicians need to be like, this is a health problem. Like if she's having this issue that's showing that her hormones are really low, we don't need to wait for her period to stop. Or, you know, I mean, this is a lot of that's going on. But
I mean, it's the misogyny. It's the misogyny of the medical system. And I think it's really important to focus on the words that we're using and call things what they are.
And I completely agree with you. This
is also, I want to really point out with female physicians, not just male physicians. You know, I've been in a conversation with my gynecologist, who's a woman that I've been going to for over 2 decades, and her whole team and her whole front desk staff are all women. But I'm having to advocate for myself with them because the conditioning and the education is so, you know, inculcated. It's such a culture. It's such a, you know, they don't even realize what they don't realize, right? So I just want to highlight the need for women to advocate for themselves and for us to support each other in that and get information like this so that we can take it to our physicians and also call them out on this stuff. If we want it to change, we have to be the agent of change.
There's still a lot of misogyny in medicine. If any woman has made it as far as she has, like it becomes ingrained in her, you know, even the older the woman is, the worse it is, right? So the younger generations are a little bit better, but it's still very, very true, you know. And I think also culturally, so like we have normalized this erectile dysfunction for men, but vaginal dryness is just as common and it's just as big of a problem, you know. And it's borderline criminal to give men a husband a bunch of Viagra and testosterone and not treat the wife. Yeah. Right. And so like you're not even addressing it. You're like not even addressing it, you know. And she's left with this like another problem, right? And this is like very painful for her. So anyway, like we also
and not to mention UTIs, because vaginal dryness then can translate into future or more common UTIs, which is a huge health risk.
Pelvic health for women is really important. And I say like a wet vagina is a healthy vagina.
Yes.
Because really like what we're talking about is this is how the vagina cleans itself. This is how we prevent yeast infections. It has to maintain a proper pH to do that. Not just yeast infections, bacterial vaginosis. Like if you have bacterial vaginosis, it's because your pH is off, right? Is your estrogen levels. Lactobacillus acidophilus, which is the primary organism in the vagina. Like we don't want a diverse microbiome there. We want it everywhere else, but like in the vagina, we just want 1 or 2 strains. And it's this primary one that makes it really acidic. It needs estrogen to make its food. If you just give a woman testosterone cream for her libido and you just give her vaginal testosterone cream, it will completely disrupt her vaginal microbiome. Right? She needs estrogen to maintain that, to prevent infection. Okay, so this is like health concern. Infection, urinary tract infections. Like I see women that it hurts so much to urinate, right? It's like so the tissue gets so thin and fragile and atrophied. Can you imagine if a man like that happened to a man? That absolutely would not be tolerated. So it's like women, pelvic health, and also urinary incontinence. Like when, women become urinary incontinent, it's like their world becomes smaller, right? Because they can't. So this is really important from a health standpoint, pelvic health, vaginal health. And it's never about sex at first. Right. But then it's like, as the sex gets better, everybody's like, this is great. Right. Because then sex starts to feel better and sensitivity increases and ability to orgasm, like all that those get better eventually. But at first it's like, it's about the health stuff, right? Look, you've got to have
Yeah, I call it the menopause hierarchy of needs. And, the physical health is the foundation of that. Hormonal health is the foundation of that. And if we don't have that, it's really hard to solve any of the other problems because our whole system is really destabilized, starting with the body. But of course, as a psychotherapist, I just want to connect the dots between the physical health and the implications downstream of our own psychology, of our own mental health, and certainly of the relationship health. And when the relationship health starts to go, I mean, that is a huge pain point. I mean, we know that people in relationships live longer. There's such a high rate of divorce at midlife and with menopause. And I can't underscore this enough. And this is, I think this is one of the errors of the Descartesian split, the mind-body split and the mechanistic paradigm that we look at medicine with, meaning we're separating everything out into its individual parts and not looking at the whole system being not just the whole body, but the body, mind, spirit, and the downstream implications of that, again, across our lifetime, but certainly across all the different realms of our life.
No, I completely agree with you. And I think it's a great way to put it. And I also agree with this, like the relationship starts to break down and, we have this divorce rate and it really impacts really. And then sometimes that's when women come into the office is when it hurts to have sex. My husband wants to have sex all the time and now it's hurting my relationship. And so I also think that we should tell women at an earlier age that they need to prioritize their own sexual well-being because we as a society prioritize men's pleasure first, right? Yes. So this is like, so if we started young, and I think it's how we talk to our daughters about it.
Hopefully it's changing in the culture.